Today I'll be talking about shoulder impingement and frozen shoulders. Frozen shoulders or shoulder impingements, usually patients will come in talking about pain on the deltoid area of the shoulder, not the back of the shoulder, but usually in this area. It can be caused by trauma or repetitive overhead activity. It's called a frozen shoulder if you have loss of range of motion in all planes, so forward elevation, external rotation, internal rotation, and if you can feel a block to motion in all planes, then that's when it becomes a frozen shoulder instead of just a regular shoulder impingement. So the pathophysiology is inflammation of the rotator cuff or the tissue over the rotator cuff that protects it, called the bursa, and it's usually caused by the rotator cuff of the bursa hitting the bone on the undersurface of the acromion bone that causes it to become inflamed when you raise your arm. On exam, we'll look for range of motion, provocative signs such as Hawkins and Neer's impingement signs that I'll be demonstrating in a few minutes. And then the imaging studies on X-ray, you can sometimes see the bone spur. And then on the MRI, it's usually negative or shows inflammation of the rotator cuff or fluid in the bursa. The treatment is usually anti-inflammatory medications, therapy, injection, and surgery if all else fails. And we sometimes do what's called manipulation under anesthesia if we're not able to unfreeze the shoulder with anti-inflammatories and therapy alone. It is important to look for signs of shoulder impingement and frozen shoulder. And if you see any of these signs, taking anti-inflammatories for about 1 to 2 weeks, stretching your shoulders will often result in resolution of these symptoms. But if that does not happen, then I would recommend seeing an orthopedic surgeon as soon as possible. So when I'm examining a patient, again, this is Ashley, my medical assistant, demonstrating to us. I would push on the greater tuberosity and biceps, which is in the front part of the shoulder right here. And a lot of times they'll have pain. And I would compare it to the other shoulder. And then when I bring the arm across the body and do this, this is called the Hawkins sign. And then often she'll say that she has pain there. That's a positive Hawkins sign. And then a positive Neer sign is when you lift the arm up. If you lift the arm up again and she describes pain in the deltoid or outer part of the shoulder, that is again another sign. And then I would test the range of motion in all planes, forward elevation, external rotation, and then internal rotation is reaching behind the back. And then for frozen shoulder to be there has to be limited motion in all planes, meaning forward elevation is limited, external rotation is limited, and internal rotation is limited, and you can feel a blocked motion. That's when you call it a frozen shoulder instead of shoulder impingement. Thank you. If you are feeling any of these symptoms currently and you need to come in to see me, please go online and book your appointment at Peachtree Orthopedics. Thank you.